Hello, welcome to OET Medical online YouTube channel. My name is Trevor Gordon. I'm one of the founders and a teacher at OET Medical. There are two of us. There is myself and my colleague Philip Wynn. This channel we've created is to provide you with video lessons, tips and techniques to help you prepare for your upcoming OET test. So the first thing we're going to do is look at the reading section of the test. So the Occupational English Test, or OET, was recently introduced into the UK for medical professionals whose first language is not English to take up roles within the English NHS, National Health Service, or in private companies. The test involves being able to demonstrate your proficiency in reading, writing, listening and speaking to a standard set by regulators. To pass the exam, all candidates need to score at least a B in all four elements. The highest possible score is A. In our videos, we will walk you through different techniques and give you tips. But for this introductory video, we're just going to give you an overview of what the exam entails and what's required for you. So let's look at the reading. The reading section consists of three parts, parts A, B and C. The total time for the test is 60 minutes. It's broken down into three parts. A, which is around 15 minutes, and B and C combined are around 45 minutes. There are a total of 42 questions. Part A contains 4 texts on a topic a healthcare professional might use at work. These documents or these texts are taken from a variety of sources. You have 15 minutes to answer 20 questions, and at the end of the 15-minute test you have to actually hand in your question paper. Part B contains 6 extracts from workplace communications in a health setting. So it could be 2 consultants or doctors having a conversation. It could be in a hospital ward. It could be in a GP's practice. It could be in a variety of situations. These extracts are quite short, 5 minutes roughly. No, less than 5 minutes, sorry. They're quite short, a few minutes. And you have to answer multiple choice questions, 6 multiple choice questions. Again, estimated time around 10 minutes. And part C contains 2 much longer passages about 2 different topics. You have 8 multiple choice questions for each text, and these are also multiple choice questions. This part of the exercise should take you around 35 minutes. The 4 main skills you'll need for reading are skimming, scanning, context reading and intensive reading. Skim reading is quick reading to get a main idea or gist. Scanning for specific information. Context reading means understanding the overall meaning of a sentence without having to understand each individual word. Intensive reading means reading through larger portions of text to identify detailed meaning. You'll be using all 4 of these skills during your reading test. Listening. The listening section consists of 3 parts with a total of 42 questions. The test lasts for around 40 minutes. You only hear the recordings once. Again, this is split into 3 parts, A, B and C. Part A is a healthcare professional talking to a patient. There are 12 gap-fill questions and should take around 10 minutes. Part B is 6 extracts from different workplace scenarios, 6 multiple choice questions, estimated time around 15 minutes. And Part C, much longer recordings. There are 6 multiple choice questions about each topic, and this part should take around 15 minutes. Skills needed for this are prediction. Predicting what the answers could be based on the information on the question paper. Using knowledge of your profession to make an informed guess prior to listening. This will give you an idea of what words you need to listen for. Paraphrasing. Different expressions with the same meaning as the text. Synonyms. Different words with the same meaning as in the text. Understanding context. It means, again, similar to reading, having an overall understanding of a passage or a section of text to find the information you're listening for. Speaking. The speaking part of the exam consists of a warm-up conversation to begin. This conversation is not evaluated, so you will not be marked on this. This is part of a warm-up. This is designed to get you comfortable, relaxed, to get you familiar with the interlocutor's voice, and for he or she to become familiar with your voice. Yes? You should practice warm-up conversations, which will be questions about your job or career, and possibly some personal questions about family and hobby and other things, likes, dislikes, just the everyday conversational topics. The main body of the speaking test is 2 role plays, role play 1 and 2. The role play, each role play is 5 minutes in duration. You will be given a card with the information of the situation, your information. The interlocutor will also have information for what their part of the role play will be. You have 3 minutes to look at the information, ask any questions. You can ask the interlocutor any questions about what's on the cards, and if you're not quite sure about something, get it clarified. After this 3 minutes, you will be asked to begin speaking. For role play 2, it's an exact repeat of role play 1, except there will be a different scenario. But again, you will have the 3 minutes to look at the information and ask questions and take notes before you begin speaking. At the end of the test, you will return the role play cards that you were given. The skills you will need for this part of the test are the ability to introduce yourself in a variety of situations dictated by the information on the role play cards. So if you're going to someone's house as a home visit and you know that person, you don't have to introduce yourself. But if you're visiting a patient on a ward and this is the first time that you're meeting the patient or the patient's relative or representative, you should introduce yourself. So there are 2 simple different situations that you have to decide how you will introduce yourself. You also have to start the conversation. You will always be asked to begin the conversation. You must keep the conversation flowing or going. If there is a lull in the conversation, a lull means if there are any breaks in the conversation, it's your responsibility to make sure there aren't, to keep the conversation going by either asking questions or giving the patient information. You also need to listen effectively, because the patient will have a number of points they want to ask or mention, so make sure you're listening to the patient also. Reassuring the patient if they have any concerns, using the correct language, the correct vocabulary of reassurance. Instructing the patients, giving them clear instructions in, for example, taking medication or doing certain exercises if it was physiotherapy, for example. Showing empathy. If the patient's nervous, anxious, worried, angry, whatever, make sure that you can show them some empathy to try and understand their situation. This empathy will be used to make them feel more at ease. Asking both closed and open questions in appropriate situations. Depending on what kind of answer you want, you will ask the appropriate question. Closed questions will be simple yes/no answers. Open questions will require more information from the patient. Writing. The writing part of the test involves writing a letter, usually to another medical professional. There are 3 types of letters: a referral letter, a request for information letter, and a discharge letter. At the beginning of the writing test, you will have 5 minutes to study the information. During this time, you cannot do any writing. You must only read. So put your pen away. If you're tempted to write something, put your pen out of your reach so you can't, and just focus for that 5 minutes on reading. For the next 40 minutes, you will be writing. 180 to 200 words is the guideline. That guideline is only for the body of the letter. So just to clarify, the address, the name of the person you're writing to, the patient information, RE, and the date, all these things are not included in the 200 words. The 200 words, or 180 to 200 words, sorry, begin after dear Mr. or dear Doctor, whoever you're writing to. After that, that's when your 200 words begin. They do not include your valediction, yours sincerely, or yours faithfully, or whatever you write at the end of the letter. They are not included. It's just the immediate body of the letter with the medical information. Skills needed for the letter. Obviously, paramount is good grammar and good punctuation, accurate. Learning the passive tense would also be a very good idea, because a lot of the interaction in letter form uses the passive tense. The format, make sure the format is laid out correctly. Address at the top, patient information, salutation, and make sure your paragraphs are laid out with the correct information in each paragraph. Only use one paragraph per idea. Do not mix things together. Relevance. What's relevant? What isn't relevant? What do I need to put in this letter? What doesn't need to be in this letter? This will be about the person you're writing to. You'll have to consider your person you're writing to and consider different relationships. Does this person need all the information, or do they already have some of this information? So those things need to be considered. And then obviously the action that you want to be taken. This needs to be stated clearly so the reader has no doubt about what they need to do. Time should be taken to review your grammar skills, and if need be, practice writing letters to improve your punctuation and grammar. Many students do not take enough time to correct this area of their English and suffer as a result. We don't want you to suffer, we want you to get the score that you need for all elements. So care and attention should be paid to your writing. This is the end of the overview. So please visit this channel. Please subscribe to the channel for the up and coming videos and share with your friends. If you would like to have online tuition with us, please visit us at HTTPS. We actually now have a secure site, so if you want to book classes and make payments, it is actually a secure site, which is now a new requirement. So you know that when you're booking, you will be safe, or your money will be safe, should I say. Subscribe and we'll be able to share more quality tips with you, and also we'll be able to give you notice of when videos are coming out. So thank you for your time, and please visit our channel.